Aloha, everyone. Aloha again, everyone. It is Dr. Albert Lin, the traveling doctor, and this is the June 16th, 2020 COVID-19 podcast. I think it's June 16th. I keep missing the days up. And yes, I did cut myself shaving, and yes, I'm still not wearing any pants. So, yeah. Anyway, welcome to I Hate Sam coming in from Instagram Live. So, guys, a lot of stuff to talk about today. Mostly good stuff, but it's sort of mixed with some bad stuff too. So, the four things I'm really going to cover today, plus answer questions. I'm sure everyone knows and has seen the news lately about dexamethasone. I got like 5 forwards about this new drug and sort of supposedly game-changing drug. And it's a drug I've used a lot, not myself, but for patients. So I can talk a little bit about dexamethasone, or the brand name is Decadron. It's an anti-inflammatory drug. So that's number one thing I want to talk about. Number two, I want to talk about hydroxychloroquine. I know you guys are all sort of done with it, but there's been some big news in hydroxychloroquine and basically not being able to use it anymore, technically. Not just by data, but by the sort of FDA emergent use authorization. So the bad news on dexamethasone, or on hydroxychloroquine, and the good news on dexamethasone. Number three, I want to talk about the second peak, which is definitely happening. It's not the second wave. We're never going to get done with the first wave, basically. And talking about also, I guess basically the second peak getting worse, and what's going on with that, along with some updates on vaccine usage and mask usage, and just what I'm seeing in society. And I'm going to end with the big news on Hawaii and the opening. I have sort of inside info on the opening date in Hawaii, which I know all you want to hear. So welcome to Benny Leff, and welcome to Kim Chikum Lau coming in. So yeah, again, dexamethasone. The good news on that, the bad news on hydroxychloroquine, the bad news also on our second peak in the nation and in Hawaii, and how that's going on with mask usage, and good news, second piece of good news on Hawaii opening, and some international travel news as well. So that's pretty much how I'll start with things. So basically, dexamethasone, I want to talk about this. I first saw this article on the BBC. And the reason it was in the BBC was it was based on a British study. A bunch of researchers studied dexamethasone. Now, what is dexamethasone? Dexamethasone, it's an anti-inflammatory medication. It's a steroid medicine. So I know a lot of you heard about steroids with building up weight and muscles and stuff, but we use steroids in medicine all the time. The number one time I would use steroids is for people with lung disease, surprisingly enough. So chronic obstructive pulmonary disease, asthma exacerbations. We give a lot of those patients something similar to dexamethasone. It's called Solumedrol or methylprednisolone. You basically do it to reduce lung inflammation. So you can see where this is going. Now, I'm not sure why they specifically studied dexamethasone as opposed to methylprednisolone. Welcome to Jameson coming in from Hong Kong. So dexamethasone, which is Decadron, the brand name, is very similar, and it was studied So for croup, it's also given and was studied for MERS and SARS, and it didn't really have much of an effect there. So it's interesting that it has effect now, but again, it's a different virus. The other time I would tell you I would use Decadron or dexamethasone is when we want to reduce all types of inflammation. When we get really worried is like if someone has metastatic brain cancer. Let's say they have a cancer in their head or a cancer in their spine or something that's really hurting them, especially causing like bad side effects in the brain, swelling, other things. We would give them Decadron or dexamethasone. Now, and I know this goes way back conspiracy-wise, but remember when I talked about high-altitude pulmonary edema and how there was, this altitude edema that they were talking about, the lungs kind of look like that? and what you do for altitude sickness. Now, not a lot of people who are not in medicine know this. Guess what you give them? Besides acetazolamide, which is a diuretic to reduce the edema. When someone is high altitude climbing and you want to save them with their lungs, guess what medicine you give them? Well, you don't have to guess, I'll tell you. And I've mentioned this on many podcasts a long time ago. Dexamethasone. That's what you give them to sort of help them with vasogenic edema or edema of the lungs. And so now I think someone finally studied it, and they studied it in this study in coming out of England. And again, the England study, it's a good study because number one, it involves thousands of patients, number one. Number two, it's prospective, meaning that they studied it for the future after recruiting candidates, and it wasn't like a retrospective. They didn't look at data. Number three, it was placebo controlled. There were two arms. They did people who were sick in the hospital, and then they took people who were, got the drug dexamethasone, a low and a moderate dose, and they gave them, and they compared it to arm of people who didn't get it at all. As Jameson, double OJ mentioned, he said, yeah, that's crazy. I remember you mentioning this about a month ago. So yeah, I mean, I'm not saying I predicted it. I said that this was a drug that they used to treat high altitude pulmonary sickness and edema. HAPE, H-A-P-E, you can Google that. So Tracy Yen said, dexamethasone more potent with shorter half-life than methylprednisolone, also few mineralocorticoid effects, at least in dogs and cats. That's really interesting. So from Tracy mentions that dexamethasone is more potent with a shorter half-life than methylprednisolone, meaning that it lasts less time, but it's stronger. So that's an interesting thing. Maybe that has fewer side effects. Now, again, steroids are not without side effects. Again, as you know from anyone who takes anabolic steroids, there's a couple things steroids does. I mean, I'll tell you this, it has a lot less side effects than we'd worry about hydroxychloroquine generally. It doesn't affect the heart per se, but it can make you crazy. You can get weird, what we call steroid psychosis from it. Also, it raises your blood pressure. It can raise your blood pressure if you just give it. Also, guess what? It raises your sugars all the time when we have people who don't have diabetes and we give them dexamethasone or methylprednisolone, we see their sugars skyrocket. So we need a control for that and actually give them insulin when they're on dexamethasone, or at least watch their sugars to see if we need to give them insulin. Anyway, let me get to the data. The point is, yeah, so as Jameson says, roid rage. But this is a little different. Even for sick old people who are skinny and getting dexamethasone or methylprednisolone, they could go, they get a little crazy and get kind of a delirium almost, or a psychosis in the ICU. So what they did is they studied two types of doses of dexamethasone, a low dose and a moderate dose. And I think the moderate dose was 6 milligrams for 10 days. And I don't know if it was 6 milligrams every 6 hours, which is how we normally give it, or the low dose would be 4 milligrams every 6 hours. And that's how we give it to people who have like a brain cancer or a spinal cancer, metastases. But maybe, I forget if it's every 6 hours, so 4 times a day, or once a day. Anyway, there's a low dose and a moderate dose. And they compared it to people who got nothing or just standard care. And the most important thing to remember about this is that Decadron and dexamethasone showed a reduction in mortality for only the sickest hospitalized patients that were intubated, number one, or number two, just on oxygen. In other words, severely sick, intubated, and moderately sick on oxygen. This had no effect for people who were not on oxygen. In other words, even though you can get Decadron as a pill, like you would give it like hydroxychloroquine on the outside, it didn't affect anyone that wasn't on oxygen. In other words, it doesn't affect mildly sick people. It cannot work for people, it doesn't work preventatively like people who are taking hydroxychloroquine. In other words, if you just collect dexamethasone and pop it like a pill and a vitamin every day, it's not really going to help you, at least per this study, to reduce your mortality from getting COVID-19. And it won't prevent you from getting COVID-19. I got to be very clear. Dexamethasone will not prevent you from getting COVID-19. So don't go out and hoard it and try to steal it from your friends with metastatic cancer or something else, again, it is only supposed to be used in the hospital right now. And again, the early data is just this one study. It was a very, very big study, but as we've all seen, early data has been wrong before. Now, I'll tell you that early data on this dexamethasone study is way, way better than a hydroxychloroquine study. Remember, the hydroxychloroquine study was like 22 patients in France and done in a petri dish. That's a shitty study, guys. I'm sorry. That's a shitty study, and it was, not really applicable, as we can say. And that's why the hydroxychloroquine news is bad, which I'll get to. But anyway, the dexamethasone news is really good, but we want to see this come out in other studies later. And again, this is not going to be the only study. I'm sure there's going to be tens and hundreds of studies done with dexamethasone and maybe even hydrocortisone and methylprednisolone. Methylprednisolone is otherwise known as Solumedrol. And again, like Tracy mentioned, there's a different half-life and potency and side effect profile compared to dexamethasone. The other reason I think dexamethasone might be used more than methylprednisolone is that there may be a better blood-brain barrier penetration. In other words, it may not just affect the lungs. I have to ask my pharmacist friends, but I think dexamethasone may get into more parts of the body, the brain, the lungs, the heart, the kidney, other stuff, but the blood-brain barrier better than methylprednisolone. That may be another reason I think it's used. But again, I'm just speculating. I'd have to read the actual article and see what they're doing. So that's good news, because now we have a second medicine. Remember, the first one was remdesivir. That can be used. And instantly after this data came out, the British government authorized it automatically for the rest of the country. It has not been authorized, as far as I know, by the FDA, but I would be very, very surprised if the FDA didn't follow suit pretty soon and authorize it, emergent use authorize it for treatment of moderate or severely sick, in other words, oxygen-dependent or ventilator-dependent COVID-19 patients in the hospital. Again, inside the hospital, not to take as a vitamin or to take like hydroxychloroquine like Trump was taking before. So that's good news. We may have a second medicine, but again, it's only for treatment, not as a vaccine, not as prophylaxis. The other reason why dexamethasone is a really good drug is that we don't have to invent it or supply chain problems or manufacture a ton of it. We have it already. Every hospital has it, and it's way more common than hydroxychloroquine, and it's really cheap. The average, I think, cost of a treatment course, a 10-day treatment course, I think, or at least a one-day treatment course, either way, it's really cheap, is only like $40 US or 40 euro or 40 pounds or something. It's very cheap compared to like remdesivir. Remdesivir, I'm going to tell you, is like, I think $1,000 a dose or something crazy like that. It's not cheap, okay? So, so Double OJ says, politics, I'm starting to believe that some people want infections in USA. Jameson, I'm not sure what you mean by that, if you're talking about dexamethasone or hydroxychloroquine or just general politics. But again, yeah, I agree. People in America are slipping up big time, and I'll get to that later, and there is some level of politics involved with it. And it's sad hydroxychloroquine was politicized, and now it's shown to be really poor. So now it's not going to be used anymore. And this, I hope, doesn't happen to dexamethasone. And I don't see a reason why dexamethasone should be politicized. It is just a standard, easy drug that most people can get, most hospitals can get. But again, I guarantee you right now, the pharmacists everywhere are probably in every hospital trying to call in all their stores of dexamethasone and stockpile that. So good luck finding it, a stockpile, and I don't think it will do any good for you most times, okay? Double OJ says, meaning why the FDA may or may not approve. Yeah, Double OJ, Jameson, again, I agree with that potentially, but I would be shocked if the FDA does not emergent use authorize approve dexamethasone for America by the end of the month, if the data remains true and the study is released. The only reason I don't think they did it right now is the actual study has not been released. You can go to PubMed, .gov, and I don't think you can find it. It's just the authors said the data is so good we needed to tell people. But again, we've heard this story before. So I think the FDA just really wants to see the actual data. They don't want a problem like the last hydroxychloroquine study that had to be retracted from the Lancet and whatever, which said that hydroxychloroquine wasn't safe. So again, that was good dexamethasone data. I am a little surprised that dexamethasone is getting more approval and more news than still like anticoagulation. I'm still kind of surprised that there's not sort of some decent recommendations for anticoagulation to be used, because all my other doctor friends are using it in their patients. Welcome to coffee coming in. So one other, so Tracy Yen also says, let's just have everyone immunosuppress the shit out of themselves during a viral pandemic. Yeah, so Tracy, I'll explain why I think it's counterintuitive. That's exactly it. So this was always the concern. We didn't want to just give everyone hydrocortisone and just give them dexamethasone without good data, right? Because it doesn't make sense. It's an immunosuppressant, just the same way hydroxychloroquine is an immunosuppressant, right? The problem is if you immunosuppress people who have a virus or a pneumonia, let's say you take it and all you do is you have a normal virus or a normal pneumonia, you might make yourself sick. But Tracy, I'll answer your question and you're sort of like, kind of like, you know, sort of trolling on that idea with this. The reason is not that it suppresses the virus effect. It's more to affect the cytokine storm. You're immunosuppressing the cytokine storm. Now, most intensivists and most hospitalists I know, and virologists that will talk about this will say there's two phases of the COVID-19 infection. There's number one, the infection phase, which is really bad, and that's an infectious phase, like what it sounds, replication and spreading, and you start to get sick. And then the second phase is the inflammatory phase, the cytokine storm phase, which is why everyone suddenly crashes and gets on a ventilator and crashes hard. And that's why it may be counterintuitive, but an immunosuppressant like dexamethasone or possibly hydrocortisone or methylprednisolone will be possibly a good agent to suppress the cytokine storm, suppress the body's attacking everything. You know, that's why it may make sense. At a certain point, when you're intubated, when you're ventilated, when you're sick on oxygen and about to crash, it may not be about suppressing the virus replication anymore. It may be about pure survival. Oh, and I forgot to mention what the data actually showed. It showed that I think 1 out of 3 intubated patients had improved mortality. So 33% of ventilated patients, in other words, severely sick patients, had ventilated, had improvement mortality. And for oxygen people, it was only 1 out of 5, so about 20%. So 20% of oxygen-dependent people had improved mortality. And 33% of ventilated patients had improved mortality. Now, keep in mind, remdesivir got emergent use authorization approval for much less than that. Remdesivir doesn't improve mortality. Remdesivir just shortens hospitalizations by like 4 days. It doesn't improve mortality. So technically, dexamethasone is a better drug for fighting COVID-19 than remdesivir. And the other good thing is we all have it. There's no real shortage of it, at least in the hospitals yet. But I agree with Tracy. I don't think that we should let the general population have access to it at all right now. I think right now, all pharmacies should stop selling it to anyone except with a doctor's note specifically for like metastatic cancer or for some other reason. I don't want there to be a shortage in America or the world, you know? So I know some of you are immediately probably going to be calling your physician friends and figuring out how to get dexamethasone. I bet you some stupid rich people are getting their private doctors to write it for them, which is unethical, I think. Quite frankly, unethical. They showed that hydroxychloroquine news caused some doctors in the Midwest, other people, to write it for their families, other people. I would not write it for anybody. I wouldn't write it for myself or my parents or whatever. That's just bad medicine. And more importantly, you're a shitty citizen of society if you do that. Even if whether you're a doctor that prescribes it that way to hoard or you're someone that hoards it. You're a shitty person. Sorry. pardon my French. So that's the data for dexamethasone. Let me move on to hydroxychloroquine because I spent a lot of time on that. So I'll just summarize the news on hydroxychloroquine because I've talked about it to death. But basically, the news is bad. The FDA removed the emergent use authorization. And that basically means that even with the Lancet retraction, even with all the other news that it's not necessarily very bad for you, it is not good for you, for the COVID patients at least. It may be good for lupus and rheumatoid arthritis and malaria, but it is not good for COVID-19. So the emergent use authorization authorization that the FDA gave to allow doctors to treat people with hydroxychloroquine is no longer available, meaning that technically you shouldn't give it as a doctor to any patient with COVID-19 anymore. You just shouldn't use it. And I will tell you that my friends in New York who are treating COVID-19, they have told me that they have still been giving it to everyone, but I'm going to ask them whether they're still giving it. I don't think they will anymore. Technically, they could get in trouble for doing that, so that's a problem with that thing, I don't think that you should be giving it to anyone because you might risk side effects and you might risk possible lawsuits, to be honest, and I'm concerned about now the doctors that did give it for a while. That's why I think, on a side note, I think doctors, nurse practitioners, physician assistants, other people, we need sort of protection. We need laws passed to protect us because everyone was demanding that we give it to patients, and there was not great data yet that it was bad for a while, or not bad, but at least not effective. Now you could see every COVID patient that got it, or even the ones that died, you could see their families saying, hey, we want to sue all the doctors that gave it. That's really, really crappy, okay? That's a really crappy way because then you're going to sue all the doctors and the hospitals that are out of money already. And welcome to Valeria from Ukraine coming in. Wow, really far away. Good to see you. And Yudish says, thanks for calling out the lack of ethics. The lack of integrity can cause so much long-term damage as we're now seeing in the loss of public trust and faith in science and medicine. Yeah, Yudish, I will say, yeah, that's bad. So I want to call it the lack of integrity in both doctors and people. But I will also say it's not just a lack of integrity. There's been a mixed message from the World Health Organization and the CDC/FDA from the government side, from American government. And they disagree with each other a lot of times. Case in point, the mask recommendations. Right now, the World Health Organization, by the way, I don't want to get too sidetracked from the hydroxychloroquine, but the World Health Organization still does not recommend mask wearing anymore for your general person unless you're directly in contact with patients. But they're not saying it doesn't work. If you look at why they're saying don't wear a mask, they're saying don't wear a mask because there's not enough masks in the developed nation world, in third world countries, other things. If they said masks are important, then everyone would try to wear surgical masks and there wouldn't be enough a supply. Right now, we're getting to more supply in America, but there is not enough supply in the world. So the World Health Organization recommendations for not wearing masks differ from the FDA recommendations, which differ from the recommendations of like airplanes and differ from like the New York government, which differs from like the Hawaii government. You see, there's a lot of confusion. So I think that is where it's not just the lack of integrity, there's a lack of a unified message. So I would not listen to the World Health Organization. I wouldn't because how can the World Health Organization give you the right data and the right recommendations for your specific country and your specific socioeconomic status and your specific sort of culture and city? It can't. It's got to be done locally. It's got to be done the right way. And that's why the recommendations for Hawaii are going to be very different from the ones from, let's say, New York City or for Phoenix right now, which is going through a big upswing and a really shitty time right now. And I'll get to that bad news. But again, to finish hydroxychloroquine, it's bad, guys. Don't take it. If you hoarded it, you wasted money. Give it to, or flush it down the toilet, or give it to, back to the, I don't know, you can't really give it back to anyone after that. But my point is, this is sort of a lesson learned. It may not be useful. Again, maybe they will come out with data that shows it is useful for mild cases, but I wouldn't hold my breath, pardon the pun. I wouldn't hold my breath that hydroxychloroquine would be useful. So right now, only remdesivir and only methylprednisolone. A side note about remdesivir, I was really interested. I studied the pharmacology of this a little bit. It's interesting how remdesivir works. It's a very expensive medicine. The way it works is that it replaces a nucleotide for ATP. Yeah, that ATP that you studied about energy production that prevents the coronavirus, the COVID-19 virus, from replicating their RNA strand. In other words, the COVID-19 cannot replicate without the use of ATP, and the remdesivir fights that ability to create that RNA. It's sort of complicated, very nerdy, but that's how remdesivir works. Everyone studied ATP in the Krebs cycle and everything. So that's it about hydroxychloroquine. It's bad news for that. I want to go a little bit more and reinforce, like I said, about the mask wearing and the second peak. Now, you guys have had another couple of days for a while too, and you've gone out and you've seen everything I've seen. How many people are wearing masks anymore? Even just outside? Nobody. And I know a lot of people, and I want to answer one of my friend's questions. She says that when she goes outside with her kids, generally they don't wear masks anymore. And they only wear it when they come in to like an enclosed area, a store that requires it, going traveling, something where, a little bit more high risk, harder socially distanced inside a restaurant. And, I'm not saying that's a bad way to do it. At least you can do it half the time. It's better than none of the time, right? But the problem is, I think the less you wear it, the less you wear it at all. The less you wear it, even like say you wear it 50% of the time, that's slowly going to slip to 40%, then 30%, and then eventually you're going to see you're just not going to really wear it at all. And more importantly, you're going to take off and on that mask, right? If you don't wear it, that means you take the mask off. And then when you wear it, you put it back on. Every time you touch that mask, that gives you a risk of getting whatever is on your mask or contaminating your mask, So when you put it on once when you leave the home, and then you take it off when you enter somewhere safe again, then that's, in my mind, the best way to do it. But I understand why some people will not want to wear the mask all the time. So it's important right now. The rates are rising. No one is wearing a mask. I think in Hawaii, I can guesstimate conservatively about, I would say 40 to 50% of people wearing masks outside if they're not running or hiking or on the beach or something. From my estimate, about 40 to 50% of people are wearing that mask, generally just walking around outside. Inside stores and like Costco and everything, I'm sure it's higher, and inside restaurants or whatever, I hope it's higher. Hawaii's been pretty good about it, but I've seen some clips, and I know that there are some bars and other places in other states where that's not happening, and they're getting reported and whatever. Now, I want to be clear. I think we can reopen the economy. In Hawaii, I think we can open up the entire economy and let the bars police themselves, pardon the pun again, police themselves, and restaurants police themselves. And if they're not doing it well, I mean, someone will call a complaint or they'll get a cluster, and then it will be a bad news for them because they won't be able to hide the fact that they got a cluster of COVID-19, and then their restaurant or bar will get shut down again. So, I mean, you're playing with fire with it. But I think Hawaii can completely open up. The news I have on Hawaii, which is really, really huge, is that from what I understand, they are making plans so that you can fly into Hawaii by August 1st. August 1st, 2020, which is only 6 weeks away, that we can do it with testing policy in place. In other words, right now you can do it, but you have to be quarantined for 14 days. We don't have it anymore, even just for the inter-island, in other words, to fly to Maui or Kauai or to Big Island or, in between. But anyone flying into Hawaii from abroad or from even California or Vegas or Seattle, they all have to quarantine for 14 days. I think by August 1st, there will be a way to test out of it before you come. And they're going to require that. Otherwise, you have to quarantine. They are hiring contact tracers. One of my friends is a contact tracer, Yudish. I think you know her. She's a mutual friend of ours. They're being hired to follow these people who come in. And again, I'm being told from my friends who've come in that they are checking. They may just be calling once. I think they should call, 3 times, like day 1, day 7, day 14 of quarantine to make sure you're doing it. And I think they should video call. Personally, that would be my preference, to do that, because then you could see whether they're cheating. Anyone can say they're quarantining on a telephone call. You can't fake that on a video very well if you have to show your hotel room or wherever you're at. I think that should be a way to do it very easily. So anyway, Hawaii, as I understand, if you're planning to make plans to come to Hawaii, try to make them after August 1st. I think there'll be a way for you to do it. I think they're talking about getting a test at CVS, the pharmacy, the national chain pharmacy, CVS, anywhere in America. And if you get that test within 72 hours of coming to Hawaii, then if that test is negative, you'll be able to come. Now, again, I think insurance will cover these tests, but if not, and you got to pay out of pocket, keep in mind the tests may be $100 or so. So for a family of 4, you're going to pay an extra $400 just to come to Hawaii. Now, again, you won't need this test to leave Hawaii. They don't really care you're leaving. But in Hawaii, they'll care if you don't have that test coming in. So if that's negative, again, if you're just traveling solo, what's an extra $100 to come to Hawaii, which you haven't been able to come to for like months now? And then they will keep this policy in place. If you're wondering how long they'll keep it forever, guys. You will have to take that 72-hour test pretty much until they stop it and we have herd immunity and have the vaccine again. And that kind of sucks because, look, listen, I know I don't want to pay that extra $100 all the time, but that's just what I have to do to protect the people of Hawaii. I fly, you guys know, I fly almost every month. I'll be paying an extra $1,200 a year, or unless it's covered by insurance again, to fly back into Hawaii. And probably that'll be easy for me to get that test in California, but it won't be that easy for me to get that test, let's say if I'm traveling to like Japan or traveling to Australia or something, I may have to actually get that test. Otherwise, I'll quarantine again until I get the vaccine. So that's the news for Hawaii. Pretty good news, I think, on the Hawaii front, that we are getting that sort of welcome to Phil coming in, my neighbor. So Phil, I was just saying, August 1st, man, August 1st is when we are going to be able to fly back to Hawaii without quarantine, and they'll start the testing then. I think that's what I'm hearing right now from, I'm on a sort of private like conference call as a doctor with Lieutenant Governor Josh Green. So I have inside information. Get the word out. Tell all your friends. August 1st, August 1st, August 1st. That's when everybody will probably be able to fly to Hawaii with a 72-hour negative test, just before your flight. And if not, then you got to quarantine again. So I think that's what the play will be. And it's going to be a little bit different than Alaska and a little bit different from like Sri Lanka. Phil says they're defunding the National Guard still, right? Phil, I'm not sure what you mean by defunding. I think they sent it all back because, for example, Hawaii doesn't really need that anymore. We're doing pretty well. I think the National Guard may still be active in some states that need it, that are having problems. But I think generally, I think the National Guard's been, called back. So we don't really have the National Guard anymore. I mean, if we later find that there's going to be a problem, then that's concerning. For example, in Hawaii, right now, our case levels are starting to go up. Remember, about 2 weeks ago, we were having 0 cases, 1 case, 0 case, 3 case, 0 case, 4 case, 0 case, 0 case. It wasn't that bad. But now we are going to have, we are having cases. We had as high as 17 cases one day. I think we're down near about 8 or so a day now, so it's not too bad. But if we get to 30 cases a day in Hawaii, or 40 cases or 50 cases, we're obviously going to have a lot more hospitalized patients. And that would be really concerning and overwhelm a hospital. So if we start to get to 30, 40, or 50, it's already bad. And again, we flattened and killed our curve down to 0. Hawaii, and as far as I'm concerned, basically finished our first wave. We did it. Alaska did it. Not a bunch of other states did it. Phoenix, Arizona, Houston, Texas, Miami, Florida. By the way, I didn't know if you heard the news. Miami stopped opening up. They stopped. They couldn't open up to phase 3 because Miami's doing bad. So there are all these signs that the bigger cities is not going so well. So Phil said the National Guard was there taking temperatures when we landed, not do the right. So yeah, Phil, my point is, I don't know if they'll still do the temperature testing anymore. They'll probably have to figure out a way to do it, at least, to come in to help. So I don't know who's going to staff that. But the point is that they will do testing. They will allow testing, because if you have a negative test, then you don't really need to. Oh, by the way, Phil, the other reason they don't need the National Guard to do the temperature testing anymore is that the Honolulu airport is bought like $30 million worth of those like Predator like thermal cameras, the ones when you see what the Predator sees. They're going to have those with facial recognition in the Honolulu airport. So they spent $30 million to get that all over the airport. So technically they don't need the National Guard anymore now that they have that camera set up. So I think that's what's going to happen. That'll be pretty good that way. So again, Hawaii is opening up August 1st, August 1st, August 1st. Tell your friends if you want to make a plane ticket tentatively. I would say that. Now, don't quote me on that for sure, because maybe that will change if things get worse. But August 1st will do that. So Phil says, yeah, what they use at Shenzhen. Yeah, so Phil, they use it in all the Asian countries. I think like Taiwan, they use it. I'm pretty sure they use it in Tokyo, in Seoul. I mean, again, Asia's way ahead of the curve on us because they've dealt with swine flu. They've dealt with SARS. They've dealt with MERS, Middle Eastern Respiratory Syndrome, a lot more than we have. So like China and Hong Kong and Taiwan and Singapore, probably Seoul, South Korea, Japan, Tokyo, they're all more used to doing this. They've got this down more to science. So they are doing better right now. Now, again, the rest of our states are doing shitty. It's only Hawaii and Alaska. Like I said on one of my posts, you may not have seen it, America will never finish our first wave. We won't. Because finishing a first wave implies that we get down to zero and get down to 0 cases for like 14 days or 7 to 14 days or whatever they've decided. We're just not going to. Hawaii has, and Alaska has, and some states have at least 0 days for a couple of days, 0 cases for a couple of days. But the other states, we're never going to get there. So Lauren said, what about antibodies positive test to fly to Hawaii? Not sure you said. Lauren, no, that's not, because they're not finding that the antibodies are definitively meaning that you can't be a carrier, number one, or number two, that you can't get infected again, per se. So Hawaii, at least as far as I know, will not use an antibody test, positive test, to allow you to fly. I think it's just the nasal, annoying, unfortunately painful PCR test that will be used, and that's the one that I think they use for Alaska too. No antibody test, only a nasal test. Like maybe as antibody tests get better, or maybe as the research gets better, that shows that antibody positive people are just as safe, if not safer, from spreading it, then maybe they'll allow antibody tests too. But right now, when they're reopening Hawaii, it's only a nasal PCR test. So America's kind of screwed, because if you look at the America curve, we didn't flatten it down and go to 0 like Spain did, or Italy did, or Taiwan did, okay? So America, we never did this. America only did this, and a little this, and now we're going back up again, like that. So we never did this. Spain did this. Italy did this. Taiwan did this. Hawaii did this. And all of America, we did like that. That's what we're doing. So hopefully it doesn't shoot up and we get to flatten a little bit. But I'm honestly concerned that we were going to get another spike because of the protests. And again, I have to reiterate for everyone out there, if you protested and you didn't get PPE or wear PPE doing it, and you're close with other people, every single one of you should be tested. I know a lot of my friends protested and did whatever, and I really, really think you guys should get tested. It would be like sleeping with a bunch of people and not wearing a condom, and you thinking that you're not going to get anything. I mean, that's a bad example, but you know what I mean? That would be considered irresponsible. I'm not saying you shouldn't protest. I want you to go protest. But if you didn't fully gear up and do other things, you, just by definition, you're higher at risk. And I don't think this has been talked about in the media enough. They say, oh, there's a risk of it. Maybe we'll have a bump. But that's not a sure thing. If we sent everyone that protested out to get tested, it's funny, the word tested is in protest. I think that's kind of funny. So if you protest, you should test. That's what I think the new catchphrase should be. If you protest, COVID-19 test. That is what I think the take-home message should be. And even if not 100% of people do it, even if we got like 10% testing who protested, 20% who protest testing, 50% would be even better. But even if we could get 1 out of 10 of those people testing, especially the sickest ones, if you have comorbidities, you're older, you have diabetes, you're overweight, you're for god-awful reason, I don't know why, if you're immune compromised and decide you wanted to protest for Black Lives Matter, which is your right, get tested yesterday, get tested today, get tested. And every time you do a high-risk behavior, that would include going flying. Once you start flying again, I would come home, I would get tested. Lauren, yeah, I heard about that. Brian, that's a great motto. If you held a sign, get in line. Or if you protest, you should test. You know, if you held a sign, get in line, or if you protest, you should test. Lauren says, yeah, you know, Brian, let's start using that hashtag. If you held a sign, get in line. If you protest, you should test. Lauren said, did you hear that New York is not going to ask you if you were at a protest for contact tracing? Lauren, yeah, honestly, a lot of my conservative friends sent me that, and I think that's bullshit. That's stupid. That is ridiculous. And again, I'm more of a, I would say, center-left political person. I don't want to get political, but that's dumb. I mean, I think they are worried that it would be used against them demographically somehow, or that it's racist somehow, or it's whatever. It is just pure epidemiology. I would say, just like if you weren't washing your hands, that's a risk factor. If you were at a protest and not wearing, I would say, if you were at a protest and not wearing full PPE, then that's a risk factor. If you're at a protest and wearing full PPE, it's a risk factor, but not as risky. But I have seen like less than 1% of people wearing goggles and an N95 and hand sanitizing and wearing that consistently. So Lauren, I disagree with the New York policy to not ask if you're at a protest. If you're going to contact trace and contact trace effectively, this shouldn't be about politics. This is about pure data. And the data is, if you didn't socially distance, which you cannot socially distance at most of the protests I've seen, I don't care what anyone has said. I was at one. I can say about it. I was at a lighter one. That was Hawaii, and it wasn't social distance. Then you are at risk. So I think any effective contact tracing should ask you if you're at a protest. And if you're at a protest, you should get tested. So, I mean, that's another take-home point. If you're at a protest, you should be tested. You really should wear N95 and goggles, you know, if you can. I was going to show you the goggles I wear that are really light and plastically and not really bad. They're very, very light. I will try to find them, and I will show you them at the next talk. So Brian says, lots of cops are not wearing masks. Lauren said, from a health standpoint, I think it should be asked and it would help the hospitals. Lauren, 100% I agree, because it should be a screening test done even in the hospital. So Brian said, cops should be equipped with thermometers and all protesters must be scanned or arrested. Yeah, but, you know, Brian, that's an ineffective use of the cops' time, and I'll tell you that the cops won't want to do that. They are not nurses, you know. If they're spending their time, you know, scanning people and thermometerizing people and doing whatever, and again, especially those thermometer things look like guns, I think that's going to be a very bad marketing look for cops to be pointing gun-like things at people. It won't look good, and people will get all triggered. You know, they'll be all Karen-y about it, and they will be upset if cops are doing this. And I guarantee you, cops don't want to do it. Brian, from my point of view, when I looked at the cops, in my experience, what I saw at the protests, it wasn't all of them, but there were some. I would, again, put it at less than 50% of the cops were wearing masks. Maybe 33% of the cops wearing masks. They all should wear masks too. But again, it's hot. It's hard. They're sledding there. It's hot. It's in the sun. It's really difficult. The cops have a really difficult job. I'll tell you. After I went to protest, I'll tell you, I went to a cop and I thanked him. I thanked him for being there to let us protest safely. I mean, again, I'm not. Again, I do not want to get political, but I think there is room to accept what the cops are doing and reorganize them in a way, not completely defund them or whatever, but, you know, obviously protect the public safety. And part of protecting public safety is asking them if they went to a protest or not. Yeah. So that's it about the mask wearing and our second peak. I think I that's about really it from my standpoint. Again, I will warn you. I think we're going into the week, this next week, this next 14 days. What is it now? June 16th. So for the rest of the end of June until my birthday, unfortunately, at the end of June, this is the key period to see if the protests made a difference or not. Are we going to see a huge spike in numbers that's not controllable and a lot of people getting sick? Or maybe a mild spike? Maybe it won't be so bad. I'm hoping for the second, and I'm sure we'll get a spike, and I'm sure, unfortunately, some people will die from it. But my guess is that most of the people protesting were not the really sick, overweight, immune suppressed, 70-year-old, 80-year-old, really sick diabetic patients. I don't think they were going out to protest just because they were probably frightened enough. They probably self-isolate and just watch stuff on TV. Welcome to LaShawn coming in. So I think that's a good thing. And I think that maybe we won't get that peak from the Hawaii protests or any protests, but we will get a peak, but maybe it'll be manageable. So let's keep our fingers crossed. Let's see what the news shows. I would watch two numbers coming up. Number one, new active cases. Don't look at just total cases. Look at number of new active cases. Look at that for your state. Compare it to your state or your city, but really your state. That's most important. Number two, number of hospitalizations for COVID-19. Those are the two most important statistics. If those start rising really high, then I worry, especially the number of hospitalizations. That's the ultimate number I worry about. I actually don't care how many cases of COVID-19 there are. And I don't care how many new active cases of COVID-19 there are, actually, as long as the hospitalizations don't go up. If the new cases go up a day by if there are 1,000 people a day that get COVID-19 in Hawaii and 0 show up in the hospital or need to be hospitalized, a lot of them show up in the ER, but how many of them actually have to stay in the hospital? That's what I care about the most. So Brian says, yeah, no exceptions. Lauren asks, when is the next podcast? Lauren, I will probably try to do it Saturday night, or I might have to do it early Friday night or Friday afternoon, probably Friday afternoon, because Saturday I start working again. Brian says, I guarantee there will be a huge spike. One person alone infected 85 people in Asia. Do the maths. Paul Shao said, how about deaths? Paul, I do care about the number of deaths, but again, hospitalizations, the number of hospitalizations is a proxy for number of deaths, right? You can't have more deaths without more hospitalizations. So again, I would rather we don't get to deaths. I care about number of hospitalizations. And as Brian mentioned, the clusters we are seeing are super spreaders. In Hawaii, they're all in the same family. There's families of 10 or 12 or 15 all giving it to them. There was a case in Miami, in Florida, where a bunch of girls went out to celebrate, grab drinks. 15 of them went out to a bar. All 15 of them got COVID-19 at this one famous bar in Miami or Florida or something like that. And as Brian mentions, one person alone infected 85 people. You're going to get a lot of typhoid Marys, people who spend a lot of time in a family, a lot of time as friends together doing it. Okay. So yeah, Brian brings up a good point. With the use of this new steroid, mortality rate will drop. So that's a great thing. I think at the very least we'll get less mortality rate, but we won't get less hospitalizations unless we are still good washing the hands, wearing the mask. I mean, honestly, I wouldn't even care about washing the hands as much as wearing the masks right now. I mean, most people will be able to wash their hands when they go to and from somewhere, because not everyone is rubbing their eyes. Everyone got the memo that they shouldn't be rubbing their eyes and, picking their nose and picking their teeth with their fingers right now, Yeah, Lauren, I saw that. That nurse undercover, that Elmhurst Hospital nurse, she is kind of garbage. I will tell you this. She's an anti-vaxxer garbage nurse. And I did my research on this. Her name, you can look this up. It's Erin Marie. Erin Marie on Facebook. She's writing a book about it. She came from Florida to New York to try to undercover bust people. First of all, she broke a bunch of HIPAA rules, so she should go to jail and be fired and lose her nursing license. But, she's an anti-vaxxer. She has a picture with her with that Judy Miskowitz, the pandemic doctor, researcher, who's completely anti-vaxxer and whatever. So they, basically her message was that hospitals were doing a poor job, okay? And she may be right, but a lot of these New York hospitals, especially Elmhurst Hospital, were overwhelmed. So did some people get sick and did some people die that didn't need to? Yes. But what's her point? How can you be anti-vaxxer and against this disease and then say it's not important, that are saying that it was so sad how much these patients got sick, and in the same breath kind of be anti-vaxxer and support an anti-vaxxer? It doesn't make sense. She's a mom of 3 that is an influencer that's trying to build her brand, and she wrote a book that's being released on Amazon. I hate that I'm publicizing her, but look up her Facebook feed. Her name is Erin Marie. I think that's her name. She doesn't use her last name because she's getting trolled, and I think, honestly, she'll probably get fired and really hard to... she was fired. She was dragged out of the hospital because she was doing some of this stuff. And if you want to research her too, I forget her last name. It's some sort of Eastern European or Polish or Czech last name. She's American, but look up ZDoggMD. ZDoggMD, ZDoggMD.com. He's a very famous hospitalist podcaster. He has a step-by-step by the other nurses who worked with her that said how bad a job she did. Okay, so Paul says, I'm sending my kids to daycare in a few weeks. Yeah, Brian, exactly. She was a nurse Karen. She was there to do stuff illegally. So Lauren, she's bullshit. Tell everyone she's bullshit. And if they don't believe it, look at her Facebook post going back to March before she flew to New York, where she had an agenda, what she was trying to prove, okay? No, Lauren, you can look at it. Look at her Facebook post. She was in Florida. She might have been in Texas or whatever, but she definitely went to New York. She tried to influence and take selfies and take, stuff the entire time. So this woman has an agenda, okay? So Marissa and Paul, this is what I'll end on. You're both asking about daycare and return to school. Yeah, Brian, Erin Marie Olszewski. You can look up her Facebook. It's Erin Marie if she hasn't put it on private or lockdown yet. I don't know how I feel about it, Paul and Marissa. I think it really depends on what the rates show. If we have a bad second peak and we're going like this, then I think it's a bad idea to send kids to daycare, and I think it's a bad idea to send them to school. Okay? It's that simple. I can't answer that question because I don't know what it'll look like in a couple weeks. And Marissa, I definitely don't know what it'll look like in the fall. And I would say I would only send my kids to daycare or school that way, or I would feel more comfortable. You may not have a choice. I know some of you are not teachers and can't just stay home from work, but I would say that I would mainly feel safe sending them there if they prove to me that they are reducing exposure. Now, how do you do that? I know kids can't stay safe all the time, especially they're young. You're not going to get them to wear masks. You're not going to wear them to wash hands all the time. They're just going to be dirty running around. But how can you minimize their risk? Class size, number one. If they are less people in the class or the daycare than there were before by 50% or more, you might have to pay for that. I don't know. But then I would feel more comfortable. Number two, if they had a lot of hand sanitizing stations around and that kind of stuff, that and you see that if it's not the kids, at least the adults are doing some of that stuff. Okay. Yeah. So there you go, Brian. I hate that I'm advertising for this nurse, but if I didn't talk about it ahead of time, I'm sorry, really sellout traitor nurse Erin Marie is basically she's like the pandemic nurse. She's anti-vaxxer. She'll say she's not, but she supports it. She has a picture in her Facebook feed with that Judy Miskowitz lady. She has it. I screenshot it. I can send it to you later, okay? And conspiracy people will love her because she's a pretty white woman who's a nurse who makes it sound like she did investigative reporting. And again, she was on Fox News, and even Tucker Carlson interviewed her for 5 minutes, realized she was pretty much garbage, and had to cut the interview short. So, I mean, it's kind of that way, So if you hear about it, again, she's garbage, and I will probably put up a little note that shows. In fact, I'll post up the picture that will show that she is an anti-vaxxer, a conspiracy theorist, to prove to everyone that she's garbage. And I would encourage you to pass along that post and pass along that picture to show, okay? And maybe she'll hate it and maybe she'll troll me, but guess what? I'm a doctor. I've gotten much thicker skin from all that. So anyway, guys, I'm coming on an hour. I really, it's sort of my first day off. I got a couple days off. I got to do some errands, get out there, have my lunch. So I hope you all are safe. I think things are going well. Again, we have two good pieces of news to summarize. Dexamethasone works well and reduces mortality for hospitalized and oxygen-dependent patients. And Hawaii is going to open probably by August 1st with some testing that hopefully you're not too cheap to pay for or to use. And then that's the good news. And again, the bad news is hydroxychloroquine doesn't work. We should stop using it. And obviously our second peaks are worse. So use your mask. If you protest, go test. If you protest, go test. Hashtag. If you protest, go test. And wear your mask still, okay? That's it. So that's me. Again, I am Dr. Albert Lin, the traveling doctor, on Instagram at @thetraveling_MD, on Facebook and Twitter at @thetravelingdr. I do have my webpage and my YouTube channel. All these videos will be saved on my stories and my Facebook story, Instagram story, and YouTube channel. Feel free to forward it along and share it to anyone. Please tag me in that again too. I would just like to get the word out. And also, again, I am now on the weekly conference call with Lieutenant Governor Josh Green in Hawaii. So I will have all the inside information first, and I will relay it to you about anything relating to COVID-19 with Hawaii and travel and anything else, okay? So that's it, guys. Stay safe, wash your hands, wear your mask, and please get tested. If you, I would encourage you to hold up that test. I would be proud of it, okay? Lauren says, oh, interesting. Lots of nurses on the COVID floor tested negative for antibodies. So that's interesting. So I'm assuming they did a really, really good job or didn't get sick. So I'm just happy about that. I don't know what that means, Lauren. And I'm assuming you're talking about the New York City nurses, but I'll wait to see that data. Maybe I can research it and look at it later. Okay, guys, best of luck, good luck, stay safe, and keep your family safe, okay? Aloha.